For a child with a tracheostomy tube, emergencies can occur at any time. It is important to be able to identify any problems and respond quickly. You must have emergency supplies with you at all times, whether at home or on the go. Supplies that should be kept close by for your child with a tracheostomy tube include ambu bag and appropriate sized mask, same size trach tube with trach ties on them ready to go, downsized trach tube, which is a tube of smaller diameter or size, suction supplies, including suction machine and suction catheters, scissors, water-based lubricant, a syringe if your child has a cuffed tracheostomy tube, distilled or sterile water if needed to inflate a water tracheal cuff, oxygen tanks and tubing, pulse oximeter, power cords for all electronic equipment, and emergency phone numbers. All of this equipment should be kept close to your child's bedside. Additionally, you should always have a go bag to carry all necessary emergency equipment whenever you leave the house. There may be times when your child requires an unplanned trach tube change. Examples include the tube accidentally comes out, you are unable to pass a suction catheter or unable to give breaths or bag the child with an ambu bag, the tracheostomy tube is blocked with mucus, not cleared with suctioning, there is a change in your child's respiratory status that is not easily fixed. If a second caregiver is not available, do not wait to replace the trach tube. It is important to be able to identify when your child is in distress. Respiratory distress is a term used when someone is having trouble breathing or working harder to breathe. Signs of respiratory distress may include low oxygen saturations, nasal flaring or flaring of the nostrils, head bobbing, fast breathing, noisy breathing, retractions or pulling of the muscles between the ribs or below the ribs, skin color changes such as paleness or blueness of color. Other subtler signs or less obvious signs could include clammy skin or sweating, or your child is anxious or agitated. Depending on why your child needs a tracheostomy tube and or a ventilator, he or she may have some of these signs at baseline. It is very important to know what is normal for your child so that you can know any changes from this baseline. The faster you identify a problem and intervene for your child, the more chance you have of preventing it from getting worse. Things you can do to help your child if they are having difficulty and not able to return to baseline include suctioning the tracheostomy tube to clear mucus, administration of oxygen via the trach or ventilator if saturations are low, using the ambu bag to give breaths to bring up oxygen saturations, utilizing albuterol, which helps to open up airways and remove secretions. If your child uses a coughilator or cough assist machine, you can use this to remove secretions. If any of these steps do not quickly resolve the problem, you must change the trach tube. We cannot stress this enough. Even if your child does not look overly distressed, but they are having lower oxygen saturations than normal that are not fixed with any of these steps, we want you to change the trach tube. We know that hearing about these possible situations can be very scary. This is why it is so important for you to practice these skills for your child. The most important thing you can do is to remain calm, act quickly, and make sure that your child has an airway in place that is open and allows them to breathe. If at any time you feel your child is in distress, you must grab the ambu bag, turn the oxygen on, and give rescue breaths. If the breath will not go in, follow the steps for emergency trach change. If these steps do not resolve the situation, please call 911.